I was sick from March 13th until early June. I would say I was quite ill for those 3 months. And I have now more or less made a full recovery, but it definitely was not a linear process.
For people suffering from long COVID, even a short walk can leave them exhausted for days. Many suffer weeks and months of symptoms long after infection. Initially they weren't believed, but that's changed. And in December last year, $1.15 billion of funding was made available for research and clinical trials in the US. Okay, Paul, so the last time we spoke, you were quite unwell. I think you were a few weeks in to your long COVID symptoms. How much longer did that go on for?
So I had this initial illness, Emma, for a couple of months. That was when we spoke. These symptoms continued for about 2 months. And then after 2 months, they became less aggressive, but I was just absolutely exhausted the whole time. I couldn't stay out of bed for more than 3 hours. I developed brain fog. I was unable to read anything more than a few lines on an email. I couldn't read long documents. My speech became impaired if I became tired. If I did too much, I would be kicked back. So that went on for 5 months, really.
A lot of us who have, more or less recovered are still experiencing, not necessarily symptoms, but things that are just different moving forward. So for me, my menstrual period is just not the same as it was prior to having COVID. And, there must be some hormonal shift. And I know that there's a lot of patients who are experiencing that as well.
In New York, early in the pandemic, Fiona Lowenstein co-founded the Body Politic COVID-19 support group online, which is organised into over 70 dedicated channels for different topics and symptoms. It's become a goldmine of information for researchers.
Some patients are making a full recovery. Other patients are still quite sick. Other patients are being diagnosed with, additional illnesses or conditions or disabilities.
There's still so much we don't know about long COVID and how many suffer from it. Dr. Claire Steeves from King's College London is one of the lead researchers working with data collected from the COVID Symptom Study app, where users who'd tested positive consistently logged their health. They define long COVID as consistent symptoms for 28 days. 13.3% had symptoms lasting for at least 4 weeks, 4.5% stayed ill for 8 weeks, and 2.3% suffered for longer than 12 weeks. Their most recent study looks at predicting who might suffer from long COVID. They found that people with more than 5 symptoms in the first week were significantly more likely to go on to experience long COVID. This was predictive for both sexes and in all age groups. The 5 symptoms experienced during the first week most predictive of long COVID were fatigue, headache, dyspnea or difficulty breathing, hoarse voice, and myalgia or body aches. Asthma was the only pre-existing condition significantly associated with long COVID. The prediction model can detect about 2/3 of people who went on to get long COVID.
Increasing age is an increased risk factor for long COVID. And the second is the number of symptoms that you have in the first week. And we think that's quite a good marker of severity of COVID, because we know from other research we've done that also number of symptoms that you have in the first week predicts the need for respiratory support in hospital as well.
And does it matter if those symptoms are mild or serious?
Well, in our data, it doesn't. It appears it's more like the number of different symptoms in different systems of your body that are affected that really count. So if you have 10 symptoms ranging from headache to fatigue to abdominal pain, as well as those core symptoms we all know about, fever, cough, and loss of sense of taste or smell, then you're more likely to then go on to get long COVID than if you just had a couple of symptoms.
They also found there were 2 groups. Some people had respiratory symptoms with a cough and shortness of breath and the loss of taste and smell, while the second group had multiple symptoms across different organ systems. The prevalence of long COVID is reflected in Body Politic's membership numbers, which is around 10,000 and growing each day. How many different scientists and researchers have wanted to work with the group?
So we get, dozens of inquiries every week from different research institutions, everything from, individual post-COVID care clinics, which are starting to pop up in the United States and around the world, who are, looking to collaborate on research or understand a little bit more about what we've seen in the group. There was a patient-led research team that grew out of Body Politic that was formed by patients who were just members of the group.
Gina Asaf is one of them, and a group that comprises of people from areas such as research design, science, medicine, and tech.
It's going to be a year in March, so I'm at 11 months now where my body's not fully back to normal. We're collectively trying to figure this out and trying to push for more treatments and research on this.
Gina and the team are juggling their health, work, and research, but have managed to produce 2 surveys that helped create awareness of the multiple symptoms. Now they're working on a 3rd survey, looking at how long COVID sufferers react to vaccines.
We are curating questions that are important to patients, and we are, listing things that we know that's happening with us, things that we're addressing, areas that maybe a researcher that's external would not think of because we're the ones that are going through it, whether it's like physical or even like our experience with the medical system. But I think one of the areas that we touched upon that were surprising was the neurological symptoms and how many people were experiencing neurological symptoms, as much as, potentially like other symptoms like the cough and things like that.
Their 2nd survey of 3,762 people from 56 countries looked at the course and severity of more than 200 symptoms over time. Around 65% reported symptoms lasting 6 months or longer. Neurological symptoms included cognitive dysfunction or memory loss, and brain fog or difficulty thinking clearly, including the ability to have conversations, follow instructions, and drive. There were also nuances around post-exertional malaise, where symptoms can worsen after even minor physical or mental exertion.
So you have people that experience fatigue that comes from putting effort out there, but then there are people that just experience fatigue even without that. So that was somewhat surprising. It seems to be like there's different clusters of types of people in terms of, how they're experiencing the symptoms.
Dr. Peter Rowe is a professor of paediatrics at the Johns Hopkins Children's Centre, where he runs the Chronic Fatigue Clinic. He's now seeing adult long COVID patients who share similar symptoms to those with ME/CFS.
Unfortunately, the science is not good enough to ensure that the severely affected patients are always going to get better. So I think everybody who treats this problem has a number of patients that just are stuck at home and really pretty miserable.
ME is myalgic encephalomyelitis, where myalgia is the muscle aches and encephalomyelitis is inflammation of the nervous system. CFS stands for chronic fatigue syndrome. Both terms can be used to describe the overlapping symptoms, with ME used to define more severe disease. They share similarities with post-viral infection syndrome, which begins after a variety of viruses. So are there particular things that trigger ME/CFS and long-haul COVID? Can you see similarities there?
For years, it's been recognized that ME/CFS can be triggered by some sort of infection, and it's been described following a number of different infections, including influenza, and there are cases from Hong Kong from the SARS epidemic showing that people had illnesses that looked like ME/CFS after the original SARS pandemic.
In America, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, has warned repeatedly of the risk for COVID-19 patients to develop ME/CFS.
We've just submitted a report showing that the first 4 of these that we looked at really met all of the criteria for ME/CFS, which include a marked impairment of what they were able to do before they got sick, usually associated with profound fatigue. These patients have trouble with concentration, short-term memory, processing, and word finding. So these are the familiar symptoms of ME/CFS, and we're seeing them now in these patients who have prolonged symptoms after COVID.
Paul Garner is a professor in public health. Initially, he took solace in the online chat groups, but he started obsessively monitoring his symptoms and anything that might explain them.
Through my evidence-based networks, I was put in touch with someone in Norway who had recovered from chronic fatigue and who offered to give me some help, sort of coaching or some suggestions about how I might be able to deal with it. So part of my recovery has been to drop all that rumination, because actually it feeds into your expectations that you will remain unwell, that you are constantly checking your body for these symptoms. Now, I am not saying these symptoms don't exist. They clearly exist. But you can, by your behavior and your thoughts and how you conduct yourself, modify your experience of this illness. And this is not saying that it's a psychosomatic illness. It just means you can have some control over your symptoms rather than your symptoms controlling you.
Paul found exercise also helped his healing. He says he's had validation from some doctors and would like more research done. But he also understands that his story is controversial, especially amongst CFS sufferers.
Really, I think we have to move past this sort of behavioral approach to these kinds of post-infectious fatiguing illnesses and on to much more effective ways of treating people. You know, there may be some people who do improve, but really it's quite rare in my experience, and I've only been doing this for 25 years.
The World Health Organization's European branch recently said understanding long-term consequences of COVID-19 should be made a priority by health authorities. Body Politic has been advising the WHO and has just joined the Long COVID Alliance, a network of over 50 patient advocate groups, scientists, public health experts and drug developers. Launched by the Solve ME CFS initiative, its role is to educate policymakers and accelerate research. So, is this getting us any closer to understanding what is causing this?
We are getting some answers in the sense that we are now able to apply some of the knowledge that we have, from these other illnesses and other conditions that have perhaps not been researched to the extent that they need to as well. I think the most important thing is that there is a widespread understanding now that COVID can persist for longer than that, 4 to 6 week time span we were initially given. And a lot of that is due to the research that came out of patient-led research, as well as the advocacy work that Body Politic has done.
Dr. Steves and her colleagues have set up a biobank with sample donations from their app users to try and understand the biology underpinning long COVID.
The main thing that we want to really tell people about this research is that actually if you were going to go on to say, I've got a putative treatment for long COVID or preventative treatment for long COVID, who would be my groups that I could enroll in that trial or enroll in that study, or indeed then give that treatment to when the trials have shown that they're effective. So if we can identify groups of people who are more likely to go on to long COVID, then we can give preventative treatments to those people. They then may go on to have a less long illness.
Fiona has hope that the funding in the US will provide some answers. While in the UK, the National Health Service website says 69 long COVID specialist clinics are up and running.
I think a lot of us are very focused on this right now because it's our lives, but it certainly took over my life, and my life will never be the same after this.
It's all finished. I know you want more Razor stories, so don't forget to like, comment and subscribe and hit the bell button below for notifications. We'll see you soon.